Grace,
Yes.
good morning.
Good morning.
I'm Helen. I'm your nurse today. May I sit with you for a few minutes?
If you want.
I'll be your nurse today. I'm going to be here until about 4 o'clock this afternoon. And I'd like to talk with you for about 10 or 15 minutes and get a little bit of information, get to know you a little bit better.
Okay.
First thing I'd like to ask is, what brought you to the hospital?
My doctor says I have depression. Just been really depressed lately, and he was kind of worried about me, and he figured I'd be better off here. So I came in yesterday. It's my first time in a psych hospital. I don't know, some people here that are kind of, I don't know. It's kind of scary being here.
Well, I think it can be scary at first. We'll try to make you feel comfortable, though.
Thank you.
Tell me a little bit about your depression. Tell me more about that. How have you been feeling for the last few weeks?
Oh, just been crying all the time. I can't seem to function. It's like I can't think at work. I'm so overwhelmed. I feel like I'm being pulled. I don't know, I'm just like so sad. It's like my husband says I haven't laughed in weeks, and I just don't feel like doing anything. It's a miracle I barely get into work.
Have you been able to enjoy any activities that you normally do, or?
No, I stopped those things. I was a volunteer at my church, and just don't feel like doing those things anymore. And I don't know, I just stay in bed.
How is your sleep?
Well, I'm not sleeping well. I don't know. It's like I'm in bed, when I get home, I just lie down, and at nighttime, it just seems like I'll go to sleep, but then I'll wake up like at 2 in the morning, and it's so hard to get back to sleep, and I don't want to bother my husband, so I just lay there and think and cry. See, I just cry over anything. I don't want to be like this. I don't want to be a burden to my husband. Have him some crazy wife. I don't know.
Let's talk a little bit more about your depression.
What do you want to know?
How about your appetite? Have you been able to eat? Have you lost any weight, or?
No, I can't. I don't want to eat. That's why the doctor was worried about me. I've lost like, I don't know, maybe like 5 or 10 pounds in the last month or so. I just don't want to eat. I'm not hungry. My husband tells me like I need to eat, but I'm not hungry. So just don't feel like eating. And
So you're not sleeping well. Your appetite's not good, you're not able to enjoy things, and you feel tired most of the day, and you've been very tearful. Those are pretty classic symptoms of depression.
I don't want to feel like this.
Now, in the past, have you ever had this experience before? Have you had some depression in the past?
Well, I have when I was in college. I think that was like one of the worst times. Not as bad as this, though. I was depressed, but I had to finish college, so I just got through with it. I kind of thought about maybe, I don't know, giving up and that kind of thing, but I stuck it out. I had some good friends, and I just stuck it out, and I finished, but nothing as bad as this. I've never been like this.
So you were able to cope by staying busy and getting support from your friends.
Yeah, just staying busy. Yeah, that way I didn't have to think. I didn't have to think about anything. Felt like such a loser.
Is there any history of depression in your family? Mom, dad, grandparents, siblings?
My mom, it seems like she's been depressed her whole life. She takes some medication, some antidepressant, and she takes Xanax for her anxiety. I don't know, I know she has depression. And then my uncle, I don't know, family says he's schizophrenic. He's been in the hospital a couple of times that I know of. I don't know what he takes. I don't know what he has. I don't want to end up like that.
Grace, have you, in the last few weeks, have you had any thoughts of taking your life, harming yourself?
That's why my husband took me to the psychiatrist, because I told him I was thinking of getting some of my mom's Xanax and just taking it and going to sleep. That way I didn't have to be a burden for him. I think he got scared. So they thought it'd be better for me to come in and have me here and rest for a few days.
Well, I'm glad that you decided to take care of yourself. Let me ask you this question. And sometimes when you get that depressed, you can have some pretty strange perceptual things happen. Have you heard any voices that other people don't appear to hear, or seen anything that other people don't appear to?
No, I'm not that crazy. I've never heard anything or seen. No.
Have you had any thoughts of that people are trying to hurt you?
Trying to hurt me?
Mm-hmm. That someone might try to hurt you?
No.
Have you been fearful of that?
No.
Okay. Have you had any angry thoughts toward others? Have you had any feeling that you'd like to hurt someone else?
No, I would never hurt somebody else, never.
Are you having thoughts of suicide right now?
Not this morning, no. Not this morning. I haven't.
Okay. Grace, this is really important. If you start to feel that way, if you start to have thoughts of hurting yourself, I want you to come to me immediately. I want you to find me, come to me immediately, and we need to talk about it. I want you to know that your safety is our primary concern right now. And we want to help you get through this crisis and keep you safe until your mood starts to come up and you can do that for yourself. And we're here for you. You don't have to make this journey by yourself. So please come and find me and we'll talk.
Thank you. Thank you. It does help to know somebody here. I can go to somebody. I will.
Now the doctor has started you on some medication, and I want to talk with you a little bit about that. He started you on an antidepressant called Wellbutrin.